Hi, everyone. Thanks so much for joining us for How She Does It. On this show, we talk about all things women, money, and power. I'm Karen Feinerman. Women's ability to access the healthcare they need is a huge issue that I've wanted to talk about for a long time, and especially women's access to IVF treatments. I've talked about using IVF to have my children, and I also have friends and family that have done the same. They couldn't imagine a world where their children weren't in it, and neither could I. While admitting to IVF is still taboo in some cultures, we've got to talk about it. There is an urgent need to increase access to affordable, high-quality fertility care for those who need it. Increasing access. That's what my guest today, Kate Ryder, did when she created Maven Clinic in 2014 after seeing what her friends went through when they started trying to have children, and later when they needed to care for their little ones. Maven Clinic, a virtual clinic, is a comprehensive 24/7 platform that offers support and referrals related to fertility and family planning, pregnancy, postpartum health, adoption, surrogacy, parenting, and menopause. Kate realized from an employer's perspective, there was limited support outside of parental leave, which left new parents to navigate an intense, complex period on their own. She noticed that it was especially challenging for first-time mothers, many who choose to leave the workforce altogether rather than navigate the complexities of having a child and working full-time. Maven is now the only U.S. unicorn in the women's health sector after raising $110 million in 2021. Kate, welcome to the show.
Thank you so much for having me. It's great to be here.
It's a really impressive story, but just going back, you had sort of a remarkable career pivot a couple of times. You have a master's degree in anthropology, then you were a memoir writer, and then a journalist, and then working in venture capital, all before starting Maven. How did you make that pivot, or so many pivots?
Yeah, it's I would say that the common thread that runs through all of them, I think, is curiosity and really trying to find the signal in the noise, whether it's for a story or a venture capital investment or even anthropology, which I studied, which I love, is just observing cultures, asking those types of questions. And so with starting a business, and particularly a business where there's a very complicated industry to work through, which is healthcare, there's a lot of questions I had to ask in the very, very early days to try to piece together what was possible. I had my own perspective on what the problem was, but what was possible, how to build an effective business model where it's always aligned to doing the right thing for the patient, and how to fundamentally shift a care model to put women and families at the center of it. So lots of questions in the early days. And I was also very lucky. My dad is an entrepreneur. So I had a built-in mentor who had to answer my phone calls at all hours of the night.
So he was your 24/7 platform. Okay. So, what did you think the problem was that you were trying to solve at the beginning of this?
So at the beginning, I did not have kids of my own yet. I have 3 kids today. So I have lived multiple journeys of the family building process. But, I had just turned 30 and my first really close friend had just had our first baby. So it was kind of that. And then other friends of mine were starting to get pregnant or were trying to get pregnant. And it was just amazing in that early group of friends who, that group of women where you tell each other everything. I was in London at the time, so lots of text messages, lots of WhatsApp calls. And it was just incredible to see one of them suffered from postpartum depression. One of them suffered from infertility and didn't have the finances for more than one round of IVF. Another one actually had a terrible miscarriage. I ended up starting my family building journey with a miscarriage, and I didn't realize how common that actually was. And so it was just, I was sitting inside a venture capital firm in London, looking at a bunch of early stage digital health businesses. And what really seemed to be missing is the fact that the healthcare industry is so fundamentally dominated by the female consumer. And yet here, the entry point often to our healthcare and the on-ramp to the healthcare system, which is your reproductive health, your fertility, pregnancy, it was just so fundamentally underserved. And so I thought, wow, here's an opportunity. And one of the entrepreneurs that I had been working with at Index Ventures, the venture capital firm, gave me a really good piece of advice, which was these journeys are not short. And so if you're going to be doing this in 10 years, you really have to care about the problem you're solving. So I thought there's no problem I care more about than creating a better system of healthcare and better access in women's and family health, because not only does it affect me, but it's of course the bedrock of our entire society and entire healthcare system.
So when you were trying to sort of pitch this, when you were going out early on, did VC funds get it? Did they understand your mission and why it was so important?
Of course not.
Of course not. That's a layup, right? But were there any women in the room?
I was starting to pitch so we raised a little bit of capital to get off the product off the ground in 2014. And in 2014, it was largely from my network from Index Ventures. So a lot of angel investors, and a lot of them were European. And there isn't the same stigma and politics around women's health in Europe that there is in America. So we had started in London, brought together just a friends and family round fairly easily, not easily, but it was $1 million. It didn't break me. So then moved to New York, moved to the US, and started to talk to more institutional venture capital firms in America. And I was shocked to not only see no women in the rooms, but B, to be just told over and over that this was just such a niche problem, because none of the data backed that up. I mean, healthcare is nearly 20% of our GDP. Women dominate 80% of healthcare. Maternity is one of the top costs for employers. Fertility at the time was it was a high growth industry. And so just sheer economically, like, that was just wrong. And yet, even though I had that all laid out, it was just being perceived over and over again that this was a niche product that really wasn't worthy of a big investment.
Okay, so you have sort of, this is really cliche, chicken and egg, but literally here you've got an egg problem. And how did you start to make inroads where people saw, wow, there is really something here? Because you're a unicorn now. And for any of our listeners who don't know what that is a business that now has a valuation in excess of $1 billion.
Well, there was a few things early on. So when you're fundraising, fundamentally you're building a list of people to talk to, and it's a funnel, right? And so I started to notice patterns in all the rejections. So I knew that if I was talking to somebody that didn't understand the healthcare industry, because if someone understood the healthcare industry, they understood how pivotal and big women's health was. But if they didn't understand the healthcare industry and they weren't a woman, there was no way they were going to get there. I had to do too much education. There were some dads who were interested in the early days, but when they brought it to their all-male partnerships, we would get rejected. And so given that there was some of these patterns, I started to just say, okay, I'm only going to meet people who are either a woman and they don't need to know healthcare, but they need to really deeply understand the problem, or a healthcare investor. And so once I started to narrow the list down, I finally, on fund 50, had success. And it was an amazing woman who was pregnant with her third child, who led our Series A. That was our worst round. And that was in 2017. And in 2018, by the time we raised our Series B, which was co-led by Sequoia and Oak, two of the best, and actually two women at Sequoia, a woman, Jess Lee at Sequoia, and a woman, Nancy Brown at Oak, you started to see more women in venture capital. And so Jess, for example, is the first female partner at Sequoia. And so since then, we have still a predominantly female board, and we work with predominantly female investors, because they not only deeply understand the problem and they really care about solving it, but they also know how big of an industry is and what the economic opportunity is.
So I'm wondering if you could have just set up shop in the fertility the clinic on, what's the closest one to Sand Hill Road? And right, but it's so interesting that you came to realize, all right, these are going to be pitches that are not worth doing. So I saw one statistic that was really fascinating, which is 90% of the women who have Maven as a benefit return to the workforce, which if you're an employer, that's got to be just a number that you're thrilled about.
Yes. So one of the big areas, and I was listening actually to Mark Cuban speak yesterday about Cost Plus Drugs, his big company. And he's like, healthcare is such a crazy industry because the big innovation I had was to just publish drug prices. That's it. That was the only thing I did that was innovative. And this kind of feels like the same thing. Like in the early days of Maven, the big thing we did that was innovative was to say pregnancy and all the needs there doesn't stop when the baby's born. There's postpartum, and then there's transitioning back into the workforce. And so when you unpack some of what was going on, 43% of women are dropping out of the workforce in that first year after having kids. And maybe some of them rejoin later, but that is fundamentally a huge area where there's clearly a major lack of support that's pushing women to leave. And they're having to make trade-offs that they don't necessarily want to have to make. And so in our maternity program, not only do we support through pregnancy, and Maven's a virtual clinic, right? So you log on to Maven, there's all these specialists you can talk to, mental health providers, OBGYNs, you have a care advocate who is helping you navigate everything. We ship breast milk with our breast milk shipping product. We cover reimbursement. We could be doula reimbursement or night nurse reimbursement if that's what the client wants. So we have a Maven wallet that helps leaders and benefits design better benefits. And then there's that whole transition back into the workforce where career coaches can normalize it for you. They can help structure it for you. A lot of the time, what we saw is if you didn't have a good relationship with your manager and you didn't have a good plan, then you were so overwhelmed after having a baby that sometimes just even that stress and that lack of structure was causing some people to leave. And so our career coaches would get in there and we have a whole back to work program to really just help people have those conversations. We also help managers kind of structure how they transition their leaders back into the workforce after having kids. And so I actually with my first used one of our career coaches because I remember on my first business trip, I was just so horrified to leave him. And he was like 3 or 4 months old. And it was just hearing someone say, listen, like you feel this way. And so do like tens of millions of other mothers who work and like through history and now, and you're going to make it through. Like, but kids don't have a memory until they're like 2. And the second I heard that, I was like, okay, I'll be fine. But sometimes you just need that encouragement so that you don't make very rash decisions.
Did you ever find, though, on those business trips, which I occasionally did, oh my God, it is delightful to be alone in a hotel room for one night?
Well, now that I have 3 kids, definitely.
Okay, by the time this will air, you will have already announced you're expanding in the Trying to Conceive health coaching service. Tell us about that.
Yes. Well, this is one that I am actually so excited about. And it's another one of those obvious things that may seem innovative, but like it's actually just so obvious and so needed. And it's amazing to me that no one has been really focused on this. But right now, there's so much space between people who get pregnant easily and naturally, and then people who go through IVF because they can't get pregnant. And there's this whole swath right now of women, of men too, who are in that struggling to conceive period. And there's so much like information on the internet and social media these days that causes all of this anxiety. And there's so little education on how to conceive that we have a conception coaching program that is trying to help drive the outcome of natural conception for people who enter the fertility track. And so the reason that that's really important is, IVF, so you went through it, it's a very invasive and expensive procedure. And if you can just take a simple drug like Clomid, which is a fertility drug, and that helps you get pregnant, or you can take a thyroid medication to level out your thyroid for your thyroid levels and then you get pregnant, or you adjust diet and then you get pregnant, or you just simply use ovulation strips. Like we see a lot of our members don't even know that you ovulate at different times during the month every cycle. They think people sometimes think it's the same time. And so these little tweaks at the margin, and then it's just like, hey, it's not totally normal for people to get pregnant on their first or second try. Often it takes a few times. And so coaching people around that can get the natural conception rate up, which is a win for everybody. It's a win for the patient, first and foremost, because they've avoided a costly procedure that maybe they need later, quite frankly, if they have like an IVF benefit, but you might need it for a later child. But if you can get pregnant naturally, you've avoided a major intervention of, you've saved up your benefit for when you might need it in the future. It's a win for the payer and the client because they're not paying for unnecessary IVF. And it's a win, I think, for the clinic as well, because so many fertility doctors, we work with so many different clinics in the US, they don't feel good about the 33-year-old who's perfectly healthy coming in and being like, oh, I'm traveling a lot and I don't know if I can get pregnant. And so I just want to go through IVF, particularly because there's an increasingly supply and demand gap where there's not enough access to fertility care as so much more demand comes online. And so this is what our program does. And it's really also just meant to dispel and debunk some of the misinformation out there. Like, I don't know if there's all these TikToks on how Mucinex helps you get pregnant. And so just like really helping people understand like what's real and what's not.
Okay. There's so much more that I want to get to, but we're going to have to take a quick break. And we're back with Kate Ryder, the CEO and founder of Maven Clinic. Okay, I want to get to another subject related to this, but I am wondering, has the pendulum maybe swung too far for egg freezing? I know there's a lot of young women out there who feel like, I want to make sure that I'll be able to have children and I'm scared and everybody else seems to be doing it. What's your thought on that?
Yeah, I hear so many stories about such young women these days thinking they can't get pregnant. In fact, somebody I work with at Maven who just told me yesterday that her 26-year-old friend says nobody seems to be able to get pregnant anymore. And so she's now thinking of freezing her eggs. And I was kind of like, oh my gosh, like I think lots of people are still getting pregnant, And so I think that when you're just surrounded by so many stories in the media of infertility and unexplained infertility, and then it's like male fertility is declining and there's all these unknown things that are causing some of these fertility declines. And you look at the global fertility rates declining in all of these different countries, you really start to think about it at an age that you probably don't even need to. I mean, many of our doctors will say whether you freeze your eggs at 26 or 30, like there's no real difference in egg quality and volume. And so I think that, I think egg freezing is great because it presents an option for you. It's not an insurance policy. It's just a shot on goal. But it's great to preserve that shot on goal if you have the ability to financially, because you can't test egg quality. So you don't know how many eggs that you retrieve are actually quality eggs. You can only test embryo quality. But I also think that like if you're in your mid-20s, you don't need to do it. So you 30 to 35 seems really reasonable. And so I again, that's just another area of reproductive health where there's so much anxiety that people are just jumping to do things without having all the facts.
So one other thing I want to ask you about your business, you have a lot of really large companies. How difficult was it to get some of those sort of first big wins? And how much easier did it get after that?
Sure. So we work with about 2,000 companies today, nearly half of the Fortune 15, and we'll cover fertility benefits, pregnancy benefits, pediatric and parenting benefits, and menopause benefits. And on the fertility side, we do a full-fledged benefit. So we have a contracted network of clinics, we have our own pharmacy partners, so we are effectively administering and we're your payer. So that's what all of these companies are offering their employees. Some of them, all of the programs, some of them, some of the programs. The first 10 to 15 big companies that we brought on, they were tough because the category yet wasn't defined. And I think there was a perception in the market that, oh, women have a doctor, why do they need anything else? And so there was a lot of education in the early days of why. And there was also, I think, simultaneously, we were living in a culture where women weren't as forthcoming about things like infertility and miscarriage and menopause. And now everyone's talking about menopause. And so I think what was helpful to us is we occasionally would find that benefits leader who was visionary, who said, oh, this is something that I know is a problem. Either I've experienced it myself or I have an associate or a child who's really struggling and I want to deliver this to my employees. But then I think fertility benefits started taking off and fertility was seen as essential care in the last kind of 5 years. And then I think return to work and gender parity in the workforce became really important during the Me Too movement. And so that was really when things started to hit for us. And then, of course, the pandemic really accelerated everything. And so now, I mean, it's still, everything's hard. Nothing's easy in healthcare. But it is, we have a lot of data now on the efficacy of our product and the member satisfaction of our users. And so it's always easier to tell a story with data.
So some of your other benefits, though, seem to have, when you're past the stage of wanting to get pregnant, having a child, onto other parts of the life cycle, as you said. Do you find that there is just as much need for those as there is for starting a family?
Oh my gosh, yes. I mean, I personally am like power user on Maven. My kids are 7, 6, and 3. So pediatrics, it's still really hard. And you as a parent, you need so much convenient, particularly a working parent. And then Menopause has been our fastest selling product in the history of Maven. We under projected all of our menopause enrollments last year. We've just seen so much growth there and so much need. And I think there's also such a dearth of research in the menopause space. Women traditionally they start to enter perimenopause, they get symptoms, they go to their doctor, and usually the doctor says, "Oh, all women go through it, good luck." And what we're finding is whether you need HRT, whether there's other things that you need to kind of manage symptoms, that women don't need to be suffering like this. And so, we look at like our top symptoms reported are weight gain and sleeplessness. And there's things that can be done, like melatonin. Maybe you don't need HRT. You just need to talk to somebody about melatonin. And so anyways, so that's been, I think, a really exciting part of our product that will continue to grow a lot. And I'm excited as well for the broader research around menopause and women's health, for all of us to kind of really publish the data around what we're seeing.
So I got to think, though, the story of we can go from providing egg freezing and fertility care and IVF and all of that, all the way the gamut to, okay, now we have a coach that can help you. Pre-fertility clinic conception that's a great spectrum for the employer.
Totally. We can write HRT for menopausal women too, right? We also work with dads for male infertility or through pediatrics and sleep coaching and low acuity pediatrics. So yeah, there's a lot we do. And I think that's one of the biggest things that employers are excited about with us, that, over the last 10 years, we've built a true platform. So all of the needs that you have in this kind of women's and family health category, you don't have to kind of piecemeal together all of these different point solutions. Not only do we deliver most of it today, we also have a roadmap for what we believe is coming tomorrow, so we can continue to grow with our clients and their members and what they need.
So let's shift gears and talk about something else. Let's talk about IVF in America. And obviously I'm talking about Alabama and sort of the unprecedented situation there. I saw your LinkedIn post, but tell us, what's your take on it and how do you think this evolves?
Yeah, unfortunately, it wasn't completely unexpected. I think it was unexpected at that specific moment, which is why no one had warning and so many patients were mid-cycle. But it was not unexpected as a broader trend of states kind of restricting access to fertility care. I think that the positive of what happened was you saw a lot of bipartisan support to step up and say, we support IVF. IVF is essential care in women's and family health. And so every time there's a step backward, the hope, of course, is that you learn from it and take then 2 steps forward. And so I'm optimistic that is happening here. The law is still, there needs to be more that's clarified, because there are still a lot of clinics that are uncomfortable. I think, you just saw in the last few weeks, like one clinic is now just stopping IVF starting next year because of things that are so unclear. But in terms of a lot of other states following suit, the backlash here was so intense that one would hope that this wouldn't be the case and that this Alabama law will also get sorted. For our patients, we have a lot of clients and a lot of members in Alabama, whether they're based in Alabama or they just have offices in Alabama. And so we got tons of questions. And actually what was interesting is it wasn't just questions from patients in Alabama, but also states that might be restrictive. So just kind of all of a sudden showing up and saying, where do I store my embryos? Should I move my embryos out of Texas? Like, should I go through IVF now? Because we don't know what's going to happen to laws in the future. And so it just, an already a really vulnerable time sparked a lot more questions. And we have travel reimbursement benefits with a lot of our employers. And so a lot of employers are leaning into those, whether it's with Maven or through their health plan. And in Alabama specifically, you can drive 2.5 hours and you can be in a clinic in network in Atlanta. And certainly many of our partner clinics in those surrounding states called us that week saying, we can accept any of your patients from Alabama. We'll fast track them. So it was devastating for the patients that were mid-cycle. It's continuing to be really hard and challenging for people in Alabama. But I'm hopeful that the silver lining is that we will not see another state take such a giant step back.
It really is extraordinary when you think about how stressful it is in the best of cases, right? And then to add on this tremendous burden of, can we even finish? I can't help but think that the likelihood of success just from the stress of this maybe goes down, right?
Yes.
It's staggering that we are actually here. So when you started to where you are right now, you must be thrilled, surprised, but how does this feel versus what you were hoping for then?
I don't, I've been asked this question before, and I haven't had time to think. 3 kids and build this business.
Yeah.
I don't know what I would have imagined. And 10 years ago, I think you really just take one step at a time. I think I can imagine more today about what we want to be in 10 years from now than I could 10 years ago, because I had never worked in healthcare before. But now, having gone through nearly all the patient journeys myself, having so many clients, talking to them all the time about their pain points, and then just like really understanding the broader healthcare industry a lot more, there's so much that we have to do that I'm very excited for the next 10 years.
I mean, it's amazing what you built in the next 10 years. I don't know what that will bring, but it's pretty exciting. Congratulations. All right, we're going to have to take a quick break, and we'll be back with lightning round. Okay, so we're back with the lightning round, which is just would you rather. The only challenge, Kate, is you can't think about it, just first thing that comes into your head. Okay. Would you rather terrible twos or teenage angst?
Terrible twos.
Ghostwrite a memoir or hard-hitting investigative long-form journalism?
Hard-hitting investigative long-form journalism.
Okay. Doctor office music or elevator music?
Doctor's office music.
Okay. Are you the first to rise or the last to go to bed or both?
Last to go to bed.
Would you rather be on the road or snuggled up at home?
Snuggled up at home.
Would you rather laugh uncontrollably or be moved?
Laugh.
Would you rather drive or be driven?
Be driven.
Okay, and the last one. What is the best investment you ever made and the worst investment you ever made, with a broad definition of investment? Could be anything, class you took, a VC round, could be anything.
The best investment I ever made was, of course, I think investing in my being pregnant multiple times while scaling a startup and just making sure that I always prioritize my kids first, and not only carrying them and birthing them, but they always come first. In terms of the worst investment, I constantly buy crap that I think is cool. And then I don't think it's cool 2 weeks later, or it breaks. So I don't know. I think there's maybe it's stuff that I might see on an Instagram ad and it arrives to my door and it's just not that great.
Okay, very good answer. Thank you so much for joining me today. I really appreciate it. Where can our listeners find you?
You can come to www.mavenclinic.com. And we do have actually an app for consumers. So if you just need a quick appointment with anybody, a quick prescription, that's also available if your company doesn't have Maven. So check us out.
Kate, thank you so much. I really appreciate it. It's really extraordinary what you've built.
Thank you so much for having me.
Thank you so much for joining me today on How She Does It. When you have a moment, please follow us on Apple Podcasts and subscribe to updates from the HerMoney community at hermoney.com/subscribe. Our producers are Catherine Tuggle and Haley Pascalides, with help from everyone at HerMoney. This podcast is mixed and mastered out of CDM Sound Studios. Our music is from Video Helper, and our show comes to you through Megaphone. Have a great week, and I look forward to seeing you here with us again. Onward.